Hi, Nick.
Hi.
Can I ask you to introduce yourself, please?
Yeah, hello, I'm Nick Hulme. I'm Chief Executive of East Suffolk and North Essex NHS Foundation Trust.
Thank you. And thank you, Nick, for agreeing to conduct this interview with me. I've got 4 questions for you.
Okay. So I start with myself. I think I realised fairly early on that I almost had to get into some sort of routine because the hours were clearly going to be longer than usual, different way of working. So physically, I work out 4 times a week in the morning before I come to work, in the garden, various degrees of HIIT classes online, and more recently, since the rules changed, I'm now working out with somebody else. So I live on my own, so that's been great. Somebody said push me, and a bit of competition there never hurt anybody. So that's the morning, and then in the evening, I always try and get a walk with my dog, because that just kind of helps me unwind and de-stress and think about the day and everything else. Depends a little bit on how late I'm getting home, but that beginning and the end of day routine has been really important, just in terms of holding it together. And I suppose the other thing is, and this is probably what I haven't done as well as I wished I had done, is just kind of sharing some of the pressures with others. It's often quite difficult in an organisation that you're leading to you don't want people look to you to be in control, to have all the answers, to not in a sense say, well, I just don't know, because nobody does. But I suppose what I've learned is it's okay to say that, and it's using the team around me to kind of bounce things off and just say, I just don't know where we're going with this, and I don't quite know what we're going to do if we run out of PPE or whatever it might be. Thankfully, we haven't. So that's how I've kind of looked after myself. And I suppose the main role that I've had in terms of the team is just kind of being available, keeping an eye. I've worked with most of the team for many years, so I know them pretty well and they know me. So I know what their stress points are. I can kind of get a sense when it's all becoming a bit much. Encouraging people to be flexible around their work, working from home, recognising some of the challenges that presents as well. We've had a couple of staff who were shielding for a while, and that was really difficult. So just keeping in contact with them, recognising the different way of working. So just being available really, and just making sure that we support each other in downtime. I did have this amazing idea that just to bring everybody together, we'd have an executive quiz on a Friday night, which was a brilliant idea until I came last. So clearly we're not doing that again. So no, but we're looking after each other, making sure people got the time and the space so that their emotions come out as well as being the key.
Thank you. I mean, it's really important to look after yourself first and foremost, which you're doing. It's also good to know your limitations. It's good to hear what you're doing to support them, including allowing them to win at the quiz. Brilliant.
Yeah. So I think in the main it's strong. We've always, and you've been a key part of this over the years, being proud of the system approach that we've taken as an organisation. I think one of the justifiable challenges of acute hospitals over the years is that we're the kind of big monolith on the hill, and everybody has to jump to our tune in a sense because people rely on us for acute care. I've been very keen over the years to try and break down some of those barriers and work much more in a system way. I always say I don't work for ESNEFT, I work for the community through ESNEFT. And I think keep reminding ourselves that the barriers that we see between hospitals and care homes and social and health care and third sector are barriers that we see. Patients don't see them and families don't see them. I think we probably didn't recognise as quickly as we should do as a system that we were one of the biggest areas of vulnerability, and it kind of makes sense really now when you think about it, was care homes. And so I think as a system we were probably a little bit slow. I'm pretty sure that we never willingly discharged somebody who was symptomatic with COVID into a care home before we started testing all our discharges. That's not something, because frankly they wouldn't have been well enough to go home anyway were that to be the case. Did a few patients get discharged who were asymptomatic? I think that possibly might have happened. So I think that it's all about conversations and communication. So I think our relationships are good. I think that any change in the normal way of working, any change in the work that we normally do, causes anxiety and causes stress, and sometimes that can be played out on either side in not a terribly helpful way. And I'm sure there are times that we could have supported nursing homes and care homes differently. We've certainly made our training available to care and nursing homes. We're now leading on doing more testing in those care homes, and we've been very clear that anything that we can do to support those homes, we will do, including making a decision very early on that we would agree a kind of mutual aid. It never got to the situations where our staff had to go in and physically support people, but we did from the outset said that if particularly your registered or qualified nursing levels become dangerously low, then we will go in and help if required. Thankfully, we haven't got there yet, and hopefully we won't, but with the offers there if it's needed.
Okay. Thank you, Nick. I mean, that's a conversation that will continue, won't it?
Indeed. So I think the biggest challenge for me has been recognising that the staff are, in a sense, facing three different pressures. So some of them are absolutely facing a very real pressure in terms of, not so much now, but certainly sort of over the past couple of months, a real pressure in their work areas. So I'm thinking of ITU, I'm thinking of our pathology staff, our ITU staff, many of our leaders, whether clinical or otherwise. I'm really under significant amount of work pressure, and a lot of other staff having to work differently, work in different places. Coupled with that, people have real anxiety about their own health and the health of their family and friends. So if you're working in a stressful environment, you're worried about taking perhaps an infection from the hospital back to your community, back to your home, back to your family, back to a vulnerable relative. That adds yet another stress. And schools are closed, so you might have children at home who need homeschooling. So work pressure, personal pressure, and then the third aspect is not having the normal, the downtime, the let off steam time. Now that might be for some going to the church, going to the theatre, going to the pub, and until recently not even being able to meet with family and friends, although the lockdown changes have facilitated that to some extent. So I think that combination of all three, I think the biggest challenge for me and for other leaders has been, how do we hold staff in a safe place, recognising that their anxiety can spill out in all sorts of different ways. So that we absolutely saw the anxiety around PPE, and you understand that for all those reasons, fear about their own health, fear about the health of the people that they care about. Now, luckily, we never got into a crisis situation or critical situation with PPE. We got close a couple of nights, but we sailed very close to the wind, but we were okay in the end, and that's improving every day. So I think that for me, just holding that anxiety of the organisation, as I said earlier, I haven't got all the answers. There are mistakes that we would have made. We're all working in exceptional, unprecedented circumstances. So I think that's been the biggest challenge. Going forward, I think there's going to be a very different relationship with the NHS and the care sector and the public. So we've seen an amazing outpouring of thanks and support for the NHS, whether it's the Thursday night clapping, whether it's the rainbows. You can't drive anywhere without seeing rainbows at the moment in people's windows and what have you, which is amazing. But I think that'll turn a bit, Andy. I think what we'll see is, we know that waiting times are going to be going back to levels that you and I can remember from a long time ago, but a lot of people are more used to shorter waiting times. They're used to having quicker access to health and social care. That simply won't be there. So I think going forward, a different conversation with staff and public about the different expectation of what the NHS will look like. And it's not because of a lack of investment or anything else. It's simply because the waiting times will creep up or shoot up significantly, and we won't be as effective or as productive because there'll be a limited number of patients just in terms of footfall that can come to the hospital because of social distancing. There'll be a limit to the number of operations that we can conduct, because we're going to have to clear the air between operations, and PPE, and staff are going to have to, so patients will have to self-isolate for 14 days, etc., etc. So I think that the expectation of patients will be different. However, and there's so much that we've learned about how we could do things differently. As you know, ESNEFT has had a philosophy of time matters for the last couple of years since we merged. And if ever time mattered, it was now, for all sorts of reasons. But the fact that we've discovered that, yes, you can do video consultations, you can be interviewed over a video, for example, as we are this afternoon, you can safely provide care in a different way. It's amazing what we managed to do with chemotherapy, for example, recognizing that there were different regimes we could use that meant patients didn't have to come to hospital as often as they might previously have had to do so. So being forced into thinking differently, which we've never really been on that burning platform in the NHS before, but we had no option now. So things have changed rapidly. Some will go back as normal, others will be adapt. Some things we'll just abandon and never do them again. So I think there is a potential upside coming out of this, which is a health system that's more digitized for the right people. It requires less attendance in health settings, whether that's in primary care or in hospitals. But we've got to be careful that we don't slip back to the old ways just because we got the opportunity to do so.
Wow, there's a lot there. And Nick, I think the anxiety is palpable at times and completely understandable. I think it's good to hear you as a leader recognizing that your staff have a life outside of work, and that's been impacted on. But as you say, the future is uncertain, isn't it, in terms of how people will reflect on the provision that you're able to provide and how you provide it as well.
I think you're right in here. I think one of the other real challenges is that there's no obvious endpoint, is there? I mean, there's no kind of, we've faced difficult winters and we've faced various crises that have been relatively short term, and we kind of know what to expect and we get on with it. With this, it's not like, well, yes, there's talk of a vaccine, which I think is an optimistic view at the moment in terms of, I remember I started a career working in HIV in 1986 and was given a 2-year contract on the basis there'd be a vaccine by 1988 and HIV wouldn't be a health issue anymore. Well, here we are, many, many years down the line, and it's still a massive health issue all around the world. So I think we've got to be careful that we don't rely on an expectation and assume an expectation of a vaccine or whatever, and assume that this is simply the way we're going to have to live our professional and personal lives. And again, it comes back to the fact that this is as personal as it is professional. And that's something that's never happened to health and care workers before. And I think that's why it's been so difficult. So my biggest learning is just don't take anything for granted. If you and I were having a conversation a year ago and you'd be saying to me, well, Nick, you're going to be wearing a mask every time you leave your office for the foreseeable future, that you're not going to be able to having your holiday this year, that you're not going to be able to see your children whenever you want to see them, that your children aren't going to be able to come and stay in your house if they want to come and visit you, whatever it might be. I am so lucky in terms of my personal situation, and I know that many people will be facing a much more difficult next few months and years. So I think don't take anything for granted. I think the other learning is that what COVID has done is to really expose and accelerate the inequalities that exist anyway in health and social care and in people's lives. The worst thing we could ever do is to not use this opportunity to really talk about inequalities in a way that we never have done before. Whether that's the obvious risks that we've seen with staff and patients who are from a BAME community, whether that's the fact that we know that people who are going to be entering probably years of economic recession, and therefore the health, both mental and physical health implications of a prolonged recession, and that won't affect the healthy and wealthy in society in any way near as badly as it will for those who are disadvantaged, who are living with inequalities every day. So my hope, although we talk about, video conferencing and we talk about how we're going to do Teams meetings, everything else, and think that's, let's use this opportunity. If we don't take this opportunity to radically think about health inequalities, then we're doing the communities we serve a massive injustice.
Good to hear you say that, Nick. Thank you very much for your time, your precious time. Thank you.
Thanks, Andy.